Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Scott Abramson. He's a neurologist. Today's Kevin MD article is How Doctors' Words Can Make or Break Patient Care. Scott, welcome back to the show.
Thank you, Kevin. It's great to be here.
All right, what's your latest article about?
Just as you said, it's about how words can really make or break communication. I think it was George Bernard Shaw who said something like the biggest problem with communication is the illusion that it took place. And if you were to interview some sort of patient-doctor interaction, and they had to visit, you interview the doctor, how did it go? And doctor said, yeah, it was great. I got a history, I did a physical, I explained what the problem is, I found it, I fixed it, I did a great job. Then you ask the patient, and the patient's gonna say, I didn't understand a word he said. And this article, what I was trying to do is focus on how the words, phrases themselves can either make good communication or break it.
I think what you say is so true, especially in cognitive specialties like you in neurology and me in primary care. They said that, the statistics, 80% of the diagnosis could be found just from the history alone, right?
Yeah.
So in your article, you present a couple of scenarios that really demonstrate how important words are. So just share those scenarios with our audience here who didn't get a chance to read your article yet.
Yeah, okay. So the first article was kind of how, when communication is challenged, how it can really interrupt that patient-doctor connection. So I was at a hospital meeting. The hospital doctor was talking to this fairly large family about their loved one. And I was sitting there kind of like a fly on the wall. I had been involved somewhat in the case, but so she was explaining to the family, and she says, and she points out, she says, and she shows on the MRI scan, puts on the screen, she says, there's a lesion here in the brain. And then she says, there's no lesion here in the liver. And then she says, I think the primary lesion is probably in the lung. And the family was, very kind of unsophisticated medically, and they're listening politely, but you could see that they were really puzzled. And finally, one brave family member says, Doctor, what's a lesion? So the doctor then just realized, oh my gosh, the last 5 minutes, they didn't understand a word I said. But she made a brilliant recovery. This was great. She said she then repeated everything, but instead of using the word lesion, she used the word cancer spot. And she went through the whole thing, and the family sort of understand it this time. And finally, when she was through, one of the family members said, yeah, but what do we do for treatment, doctor? And she says, first, we have to get tissue. And the family's looking at each other like, it's like sometimes we just never learn. And it's especially, and those are terms that we use all the time, and we just sort of assume everybody understands what that is. Yeah, Kevin, I don't know about you, but me, I'm very computer phobic. And I, if I have a question to someone, I'm almost afraid to ask them, because they're going to say something like, well, your server, this has gigabytes, and, what is your operating system and CPU? And like all they have to do is just mention one of those words. And I'm afraid to, ask. I don't want to appear stupid, and I'm just tuned out.
Mm-hmm.
So, boy, it's really important. Now, the other anecdote I mentioned was where communication just using the right words can make all the difference in the world. So I had a friend named Sharon, and she noticed this, what she called a little blemish on her breast. So she went to see this surgeon, Dr. Susan Heckman, who was one of my colleagues, Dr. Susan Heckman. So she goes there, and Dr. Susan Heckman evaluates this blemish, and it turned out to be nothing. But when she was examining the other breast, she found something that was suspicious. And she advised that Sharon, and I'm going to condense the story, but eventually she advised that Sharon have surgery. Now, my friend Sharon is one of these very kind of new age people. She believes that cancer, like any other illness, you can solve it by psychic energy. Mm-hmm. And so she's saying to herself, she says, I think I'm going to go visit the health food stores. I need to get on some healthy diet. Maybe I'll have a consultation with Dr. Bernie Siegel, a seance with Deepak Chopra. Maybe I'll do some firewalking with Tony Robbins or whatever. So she's thinking all this stuff. And she's saying to herself, I'm going to try this stuff. And in 2 months, I'll come back and see Dr. Heckman if it's not working. So as she's leaving, something is puzzling her. And she turns to Dr. Heckman. He says, well, Dr. Heckman, what was that blemish that brought me in here in the first place? Now, Dr. Heckman is an excellent surgeon, but she's also someone that really is attuned to her patient. And she could have said the usual stuff. Well, this blemish was just an epithelial lesion of no significant import. It was just a pigmented nevus with no mitotic potential. You know the drill. I mean, she could have said all that stuff. But she's very intuitive, and she had a feeling where Sharon, what metaphysical ballpark Sharon went to bat in. So she had a feeling. So she turned to Sharon and she said, Sharon, that blemish was your guardian angel giving you a wake-up call. When Sharon heard that, it changed everything. She knew that Dr. Heckman was listening to her and knew who she was. And the next day they did surgery. It turned out to be cancer. But many years later, my friend Sharon is free of cancer. She is cured. Now, yeah, and so I asked the question in the article, did getting surgery 2 months earlier save Sharon's life? Maybe it did, maybe it didn't. I choose to believe that it did. And then I think I closed the article and I said something like this: if there are any doubters of this, if there's any doubters, just ask Sharon's angel, because Dr. Heckman was her angel by using, and it was her communication skills as much as her technical skills that I believe saved my friend's life.
Now, you were a neurologist, and when you were practicing, obviously, neurology has a lot of technical terms, a lot of medical jargon. Now,
Yeah.
whenever you were talking to patients and explaining things to their families, did you sometimes have to check yourself and make sure that you were explaining things in layman's terms? Was it a conscious thing? How did you train yourself to do that?
Yeah. It really is, because I think we all tend to just talk in our own jargon terms. And if when you listen to other doctors talk, you're shocked. And when you tape yourself, if you tape yourself one of these interviews, you'll see, my God, I can't believe that I, spoke like that. So it was a learning experience for me, and constant practice and constant self-checking. And I think finally, after 40 years of practice, I think I did get a little better at it, but it's so easy to slip into it.
Now, can this be taught? I know that you've done a lot of workshops, and there's varying degrees in terms of how good physicians are in terms of communicating with patients and speaking in layman's terms. How would you teach this to a group of physicians with varying degrees of comfort in doing this?
Yeah. Well, I'll tell you the way we did it, one of the ways we did it, Kaiser, and I think this was just absolutely just, I'm so glad that Kaiser provided these resources. So we would have these communication intensive workshops. And sometimes we would do it offsite for 2 or 3 days, 4 days. Sometimes we would do it in the clinics themselves. So what we would do is we would hire these actors,
Hmm.
and these actors are very, they've been trained and know about medical things. And so then we would have, physicians who, let's say, had been struggling with their patient satisfaction scores, or some people just wanted to get better. So we'd have these interactions and we would tape it, and we would tape the interaction between the physician and the actor patient. And then we would play it, and then we would tape it, and then we would ask for input. And we'd ask for input from, the small group of people. We would ask input from the physician who was, sort of doing the role play. And we said, how did you do? God, I thought I did pretty good. I thought it was pretty good, explained everything. And then we asked the actor, and they were just playing the regular patient. How did it work? I said, and it came out like, when you said, when you said malfunction, I wasn't sure what malfunction meant. Or when you said whatever intestinal obstruction, I didn't exactly understand what you were talking about. Or so they would get direct feedback, and then we would play the tape, and they could hear themselves and see themselves say this. But to get the feedback from someone who's actually listening to them was really it's a matter of practice, because you know what, they have these things, patient satisfaction surveys, you send it out to the patient. They're not going to call back and say, gee, doctor, I didn't understand. You use big words. I'm not going to, I just don't appreciate that. They're not going to say that. They don't want to get their doctor angry at them, even though they say this is all anonymous. You're not going to get feedback that way. So that is, if you can self-correct, watch yourself do it, that is absolutely the best way for any of this communication training.
How about new physicians and medical students? They're just starting out, and the best way to learn these things is from the very beginning so that these skills
Yeah.
are learned for life. For these new physicians and medical students listening to you right now, what kind of tips do you have for them?
Well, and we did that at Kaiser. Every new physician we put through this training
Hmm.
program, and we call it the 4 habits. We try to make it a habit, and things like investing in the beginning, getting patient perspective, just making one empathic statement, and how to close the visit, effectively. So those were the 4 habits, and we teach those to the medical students. So for instance, one of the habits, let's say, is getting patient perspective. Now, and people think, well, this is really getting a good history. How long have you had the pain? Is it go down below the knee or to the ankle or above the knee or whatever? No, that has nothing to do with that. It has to do with asking more deeper questions. Of course, you're going to ask the routine questions,
Yeah.
but then you're going to say something like, "Tell me, Mrs. Jones, I've heard about the problem, but what are you most worried about?" Well, doctor, I kind of didn't want to say this, but you know, I had this venereal disease when I was 20 years old, and could it be something related to that? Or gosh, doc, sometimes I think it might be an aneurysm. These headaches that everybody says is tension. So if you can dig deeper and make that connection, not only are you just making a connection, but you are, instead of treating just a tension headache, you are giving somebody real relief, a real, gee, I don't have to worry about this anymore. I could go on and on about the teaching that the actual program that we teach and so forth, but just that's just a sort of a small example of that.
We're talking to Scott Abramson. He's a neurologist, and today's Kevin MD article is How Doctors' Words Can Make or Break Patient Care. Scott, as always, let's end with some take-home messages that you like to leave with the Kevin MD audience.
Gosh, the thing is the words we use are so important. And I read this just a little while ago in the San Francisco Chronicle. So there were these 2 guys sleeping in a park in San Francisco. A cop comes up to them and says, "Where are you fellas from?" The fellas say, "Frisco." Cop handcuffs them, takes them down to the station, and it turns out that they are escaped convicts from Colorado. Now, this is kind of inside baseball, and your audience may not know this unless you're from San Francisco. But how did the cop know to be suspicious enough to bring these guys to the station? So the thing is, so he said, "Where are you fellas from?" Said, "Frisco." Here's the thing: nobody from San Francisco calls it Frisco, right? Nobody. It's like if you're from New York and you say, "Where are you from?" I'm from the Big Apple. I mean, people
Yeah.
think you're crazy. Oh, where you from? Where are you from? Chicago? Oh, no. If someone says, "I'm from the Windy City," you think there's something wrong.
Yeah.
Or like if someone asked you, "Where are you from?" and you said, "I'm from the Maple Leaf City," or something
Yeah.
like that. I mean, so that the point is whether we are escaped convicts from Colorado or whether we are healthcare clinicians, words have consequences. Words have consequences. That's my message.
Scott, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
All right. Thank you, Kevin. Appreciate it.